I recently got convocated from VMMC and Safdarjung Hospital, New Delhi for completing my MS General Surgery. And a lot of you guys have been asking, sir, we have gotten a private college in this counseling where the caseload is not so good. Will we come out as a good experienced surgeon? So today I want to tell you something which rarely no one talks about. High patient load doesn't always mean better training or you'll be a better surgeon. Sometimes high patient load simply means more workload. And if you're not careful enough, this workload will slowly turn into toxicity. So I have completed my MS General Surgery from Safdarjung Hospital, one of India's busiest hospital. I've had really good clinical exposure. I've managed emergencies with huge caseloads, and I have also seen rare cases which a lot of you guys may not even see during your entire careers. But also, I have faced burnouts, I have faced frustration, and I have also faced silent sufferings. And there were even multiple occasions when I had felt like quitting entirely. And why is that? Because we have been conditioned in such a way that more the caseload, the better you will be trained. But the actual reality is more layered, which I'm going to share in this video. See, this video is not to defame my institute. Whatever I have learned, whatever I am today, I owe it to Safdarjung Hospital. But there are some things which a lot of you guys have to know before you choose a high volume center, let it be Safdarjung or any other for that matter. I totally agree that having more caseloads means you will get better experience, you will get better hands on, you will gain more confidence, and also you will have better decision making skills when compared to someone with less caseload. But nobody talks about the other side. Nobody talks about the disadvantages in these kind of institutes. When the caseload becomes high, the system starts collapsing, and slowly you'll switch from learning to just doing manual work. You'll find yourself running behind the file or to collect some blood investigation or running from one building to another just to get a call done. You'll start doing work mechanically because you won't have time to understand what you're doing. You won't have any time to read or to reflect back whatever you have learned that day because you would be so much overwhelmed with work that you won't even have time to have your lunch or breakfast or even time to sleep. And the only thing which comes in your mind at the end of the day is bas ye duty khatam ho jaye. And when you have so much caseload, so much workload, none of your seniors will have any patience left to teach you anything. The only thing which comes in your mind is I want to finish off the work and just have some rest. So talking about hands on, talking about the cutting experience, you are going to get a huge amount of caseload, you are going to get a huge amount of surgical hands on. But how much are you learning? How much are you progressing? You can't keep track of that. You'll find yourself doing the same procedures for entire 3 years, but you won't have a person who is constantly supervising you. You will have seniors to guide you, definitely, but even they will be burned out because of the huge caseload or the huge workload. And among all this chaos, toxicity will enter the scene quietly. And when someone hears toxicity, all they visualize is some senior shouting at you. Yes, that's a part of it, but toxicity also includes your sleep deprived days, your constant fear of making mistakes, and also feeling guilty for resting because you have so much work that you can't afford to rest. This is actual toxicity. When you want to learn something, when you want to keep track of your progress, but you can't because you're stuck in your work. And most of the times, it's not surgical work at all. It'll be you running behind files or you running from building to building to get a call done, or you're allotting beds to the patient, or you're fighting with the nursing staff because there are no drapes in the OT or there are no instruments in the OT. So majority of the time you'll be wasting in these non-productive, non-surgical works if you are in a high volume center, and the actual learning is just 10 to 15%. And after constantly facing all this, you start doubting your own career decision, and thoughts like quitting will start coming to your mind, and all you can think of is just surviving these 3 years of residency. That's what happened with me. I learned as much as I could among this chaos. I performed whatever cases I could. I gained as many surgical skills as I possibly could. But the other things which I had to face because I was in a high volume center and nobody had told me anything about it. And I'm definitely sure nobody would have told anything about it to you too. All you know is you have to enter a high volume center where there is variety of caseloads so that you will get good hands on and you will come out as a better surgeon. And I want you to realize that that's not always the case. Even in a low volume center, you can learn and be a good surgeon. See, it's not necessary that you have to perform 100 surgeries to be a better surgeon. You can just perform 1 to 2 surgeries and be the master of it. All you need is you need to learn the principles, you have to read for it, and you have to understand each and every single step with precision. And there's no time for all this in a high volume center. The only thing in mind is we have to complete the surgery soon because 10 more cases are pending. There's no stepwise protocol, there's no post OT discussion. So if someone tells you that join a high volume center to be a good surgeon, don't listen to them. What you need to make sure the institution has is it has to have a good supervision, someone to guide you at every step. You have ample amount of time to read and have time for self improvement, and a place where the responsibility is given to you gradually. But this doesn't happen in a high volume case. On day one, you'll be thrown in the emergency and you are expected to manage each and everything. You'll definitely have a senior behind you, but it is expected of you that you must be capable of managing everything as soon as possible. Try to make sure your center has a structured learning system where regular case discussions happen and regular OT discussions happen, where you actually thought what are the things you have to make sure in every step, and also a place where you will be respected for what you are. And there's also a reason why students nowadays are choosing non-surgical branches, why branches like medicine, radio, derma is taking preference over surgery. Because during internship, they have seen their PGs suffer. They have seen their PGs heartbroken. They have seen their PGs crying in the washrooms. They have also seen them sleep deprived, yelled at, humiliated, and they have also realized that this life is not for them. So that's why in this NEET PG, majority of the toppers have not chosen surgical branches. It's not because they're lazy, it's not because they're weak. They're aware, they're well aware of what getting into surgical branches can do to them. So here's my message to my juniors who are entering residency now, and especially if you're entering surgery residency. You're not supposed to romanticize pain, or you're not supposed to romanticize suffering. Your seniors may tell you that the suffering, the burnout, or sleepless nights are common. You are supposed to go through that. It's nothing like that. You have to protect your identity. You are more than any surgical unit, or you're more than your rank or your workload. So you need to have at least one safe person with whom you can share everything. You need to have one hobby, or you need to set a boundary which no one crosses. And this doesn't mean you have to skip everything and just chill. Your priority has to be learning. You may think I'm telling you not to sacrifice your sleep, not to, romanticize pain. So that doesn't mean you have to chill during your residency. Your main motive is to learn. So whatever you're seeing, you need to ask questions. You need to ask why is a particular procedure being performed, or why is a particular investigation being performed. You need to learn the protocols as soon as possible, and you have to prioritize learning something from each and every case. It doesn't have to be you have to read for 5 hours daily. Even 5 to 10 minutes would be enough. When you're in a lift shifting a patient, or when you're waiting for a patient to be shifted in the OT, those 5-10 minutes is when you can read and gain some knowledge. Because once you are in residency, nobody cares about you, whether you have learned, whether you're understanding something, or whether you're growing in residency. Nobody cares. It's your own responsibility to learn, to grow, and to make the best out of your 3 years in that particular institute. So you have to keep yourself sane during these 3 years. You're going to have a lot of negative thoughts. You will see a lot of negativity around you. So you must learn to detach emotionally from all these negativity. You have to choose which battle to fight and which battle to move on from. You need to make sure to respect the hierarchy, but also protect your own self respect. If things get heavy, you have to start talking. You need to sleep whenever you get time. You need to focus on your health, eat, hydrate, and make sure to take care of your personal hygiene. Because I've seen my seniors and juniors suffering from TB by staying in the wards. They have developed varicose veins, they have developed pneumonia, they have developed even abdominal TB. So make sure you prioritize your personal health, your hygiene, and your mental health first. If things get overwhelming, take a break, apply for leave, and go to somewhere for a few days. Go for a vacation to your favorite place. Relax for a few days and come back with a fresh mind. And remember, residency is just a phase, it's not your entire identity. If you missed out something in a residency, it's fine. You can do super specialization, or you can do any fellowship and learn from there. Don't expect to learn each and everything during residency. Just take the positives, leave back the negatives which you had faced in residency. And remember not to lose your curiosity, or self worth during residency. And if this video has resonated with you, please share it to your fellow resident who's also silently struggling. And comment below, what do you really think defines a good training? What are your views and opinions about getting trained in a high load center or a low case load center? Let me know them in the comments. Thank you so much for watching.